So the next topic that I really want to talk about is if you're a nurse, a doctor, a PA, an NP, anyone that has a license to be able to give an aesthetic injection like your anti-wrinkle injections, your filler, you're probably asking, where do I start? So one of the biggest ways to get started, if this is something you're interested in, is to get trained. So there are tons of places that are sprouting up with training. If you just Google how to get CME certified in aesthetic injections, or you can say, how do I get trained in botox? There'll be tons of resources available to you. Now, some things to keep in mind would be, how long of a training do you think that you need? And realistically, I recommend a course that's at least 3 to 4 days. So a lot of these courses that you may find offered throughout the country, there's often these classes that are rotating, and they kind of go all over the United States, and you'll kind of see one day in Oakland and the next one will be in Florida. A lot of those are very tempting, I think, because it's a Saturday, you can kind of fit it into your schedule. But if you're actually serious about doing this for clients, one day is not going to give you enough time. I did a 4-day course, and after that, I was still had so many things I wanted to research, things I needed to talk to people about. And so if you're anything like me and you need to know absolutely everything about a procedure that you're about to offer your patient, and you need to get lots of practice, then I really encourage you to do at least a 3 to 4 day intensive course. So some resources to look at would be American Academy of Facial Aesthetics. They have great free content online as well as rotating classes. I went to National Laser Institutes in Scottsdale, and I really like them because they have a consistent class schedule that they offer throughout the year. And so you know that they're gonna have those courses and you can just fly there. You meet a lot of people. I met injectors that I still talk to every single day because we run cases by each other. We talk about, have you heard of this? And so the second part of it is ensuring that you're going to find a CME course that will also integrate meeting other people. So if you go to something that's on the smaller side, you may get more attention, but you need to ask how many other people are going to be there, what's the class size like. So at National Laser Institutes, where I went, we had a large lecture hall. So I think there was probably, 30 people in there, but then we split off into little groups to do mostly hands-on injecting for the most of the course. So you got the big group, and then you broke off into small groups, which gave you personalized training with an injector. So those are just some things to think about. I generally will recommend one of the courses that you know that you can count on, like National Laser Institutes, as opposed to the ones that kind of rotate that you don't really know when they're going to be where. If most of us are really busy and due to time constraints, it's really helpful to know when their next class offering is up through the next year. So just some things to think about, and watch my other video called Consider This before you pay for one of these classes.